our members of this August gathering, ladies and gentlemen, I have the honor to invite the presenter, Dr. ALIYU HAMZA BALARABE, who has the next 20 minutes to speak on the importance of healthcare in the socio-economic development of Kebbi State. He is the current Chief Medical Director of the Federal University Teaching Hospital, Birnin Kebbi. The lead speaker, kindly come forward. You have the next 20 minutes to deliver your paper. Please welcome him properly. Thank you.
Is to take place tomorrow. It is being supported with Sight Favors International, and it was really by Bloomberg Philanthropies of UK that actually supporting this initiative. That's why I sincerely appreciate the opportunity given to me to be able to make this brief presentation. I am delighted to have been invited to deliver this important lecture at the 2025 Annual Conference and Cape Economic Development Summit, happening for the first time, organized by the Kebbi Elders Consultative Forum. The theme which we have carefully listened to it today, it's about Kebbi Ascent, unlocking opportunities for inclusive growth and sustainable development in Kebbi State. I want to quickly mention that my background as a medical doctor, I had the opportunity to complete a master's I did master's in 2023, actually in health economics at Bayero University, Kano. So that's why I try to do an introduction by trying to link the relationship between healthcare system as well as economic development. If you look at the definition of health by the World Health Organization, it's a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. Even though we look at having health to be complete might not always be attainable at a particular point in time. Then for an individual to remain healthy from time to time, there is a need for an organized healthcare delivery system. Because as human beings, we are bound to be faced by illnesses, by diseases, and those illnesses and diseases are supposed to be prevented, are supposed to be treated, are supposed to be rehabilitated. And when that happens, it may still restore the ability of your system to be able to coordinate so that you will remain a healthy individual. If you look at the economics, in the economic sense of it, it's about the ends and scarce thing, because what it means about economics is that these resources that we need are not always available. And that's why it is really timely for us to be able to look at the position of some of these sectors within the context of the economic development and see how much of available resources can be allocated so that these sectors can perform equitably. One thing about health is that health doesn't work in isolation. Every other sector of development has an indirect linkage with health. If you have bad roads, people are bound to have accidents and it will overburden the health system. If you do not have very good policy around your agricultural products and productions, it means you are going to be bedeviled by either issues around malnutrition or you are going to be bedeviled by issues around overnutrition. And whichever one of them happens, it has implication for the healthcare system. If you do not have energy security, it means you may not have the input that will enable you to deliver quality healthcare system. If you have insecurity, it means people are at risk. The threats are there. So health doesn't exist in silence. If you are going to give a comprehensive healthcare for individuals, every sector of the economy should equally be seen to be important. What is the application? The application of theories, concepts, and techniques of economics to the health sector is health economics. And that is concerned with issues like allocation of resources within the various healthcare strategies. It's not just about how much money are we able to allocate to healthcare. What is the quality? What is the quantity, the amount that you need to allocate? If we look at Abuja Declaration, and this doesn't apply only to Kebbi State, but also to states in northern Nigeria and even the country at large. The Abuja Declaration requires that at least 15% of the annual budget of every government should be channeled towards health system. But if you look at in Nigeria, that has always been lagging behind. If you look at the context of the entire planning and budgetary provision, health system has never gone beyond 5, 6, 7%. But then, it's not just about the quantity. What is the quality? Where are you applying these resources? What are these resources able to do in a more accountable manner? These are important so that we can have a comprehensive healthcare system. Why is health important? What is the importance of health economics in a socio-economic development? By this, resources in the health sector, like other sectors, are limited. The main function of health economics is to apply economic theory to practical problems of rationing the use of resources for effective healthcare services in response to people's needs and demands. There is increasing attention on health economics globally as a result of renewed cost consciousness within the health system and the shift from exclusively humanistic approach to one incorporating an increasing use of managerial techniques and quantitative research methods. Now, if you look at the concept of scarcity, it means health economics has become an important area of health for which needs some level of understanding. Health plays a major role in the socio-economic development of people. Health can no longer be seen as a byproduct of development, but rather a precondition for economic development. The health sector is just one of the economic sector. Every sector has a bearing, like I have earlier mentioned. Economic development requires a healthy workforce. Improvement in health status of the country represents both gains in welfare and an investment in the country's future. So we have to see this. Some of the economic benefits include increased productivity and labor supply. It's also an enabler for job creation. You need human resources to be able to run health sector. It has a prospect for economic growth. It is the backbone of the human capital and societal benefit in the area of improved child development, enhanced educational attainment, poverty alleviation, increased financial risk protection, resilience and long-term stability. Resilience and long-term stability in the area of economic resilience and sustainable development. At this point, I want to quickly emphasize on the structure of the Nigerian health system. Nigerian health system doesn't exist by having Kebbi State as an entity outside of the actual Nigerian health system, which is interrelated. If you are going to look at the socio-economic indices in Kebbi State, you will see it's not different from what happened in Sokoto, in Zamfara, in Jigawa, in Kano. We look at the statistics, you will see in the Northwest is usually not far different from the statistics that you equally see in the northeastern part of Nigeria. So we don't speak, we have to speak as one system which coordinates both at the federal level, at the state level, at the local government health authorities, the World Health Committee level, the village health, the private health sector, traditional healthcare providers, and alternative healthcare providers. There is something that has happened in Nigeria. In 2023, we have always emphasized what are the challenges in the health system. And these challenges are always the same. The infrastructure is not there. Even when the infrastructure is there, it's in a dilapidated position. The financing to health sector is limited. If you look at the human capital development, the number is not adequate. even the number that is adequate, sometimes there is maldistribution of this health personnel so if you look at the challenges, what do we do? So Nigeria articulated a very bold and ambitious health sector strategic blueprint which aims to save lives and reduce physical and financial hardship for all Nigerians. The Nigerian health sector. Hello. The Nigeria Health Sector Renewal and Investment Initiative was able to bring everybody on board. The federal government, development partners, the state governors, they signed the commitment about this. And with this, the strategic intervention was to revamp the health system as a product of intense and rigorous diagnosis of the sector, jointly undertaken in 2023 at the inception of the current administration of the president. Now, the strategic interventions were actually given to revamp the health system as a product of an intense and rigorous diagnosis of the sector. This was jointly undertaken in 2023 at the inception of the current administration. This is implemented using the sector-wide approach with the overall goal of saving lives, ensuring access to high-quality health care for all Nigerians at all the three levels of healthcare, both the primary, the secondary, and the tertiary, with local government authorities, state and federal government respectively taking different but yet collaborative responsibilities. The most important aspect of health system, the health system that is delivered at the primary care level. It is mostly concentrating on the issues around prevention of diseases from happening, about health education, about immunization, about family planning. For as long as the health system is not addressed at the level of the primary health care, our statistics will forever not be great. So the strategic blueprint is composed of 4 pillars. These 4 pillars are building effective governance to ensure federal, state and development partners work in a much more coordinated way that fosters accountability. We need to have this blueprint and everybody should come together so that there is coordination in where the destination is going to be. There is also building a more effective, efficient, and equitable health system where women and children especially have access to a full range of services ranging from health promotion to medical treatment at health facilities and through community-based care regardless of the cost. Unlocking value chains to build resilience, local market for locally produced medical commodities, supplies and equipment. Health sector is one sector that depends on really innovation and technology. So it's highly dependent on machineries. If you come, you'll be able to see a doctor. You'll need equipment for radiological investigations, for laboratory investigations. You need consumables so that those investigations can take place. Now, over time, Nigeria as a country, we have over-relied on importation of most of this. This is one economic line that we can take. And that's why there is an initiative, even at the federal level. It is called PVAC. And that PVAC initiative is a presidential initiative in value added chain. It means, how do we begin to produce locally the vaccines that we need, the essential medicines that we need, the basic kits that we need? As simple as the diagnostic kit. Why do we have to rely on inputs? Why don't we create incentives so that there is local production of some of these things within the country? And then finally is taking health security measures to ensure that there is increased surveillance and response to potential medical outbreaks in order to interrupt their progression. Everybody is aware of what happens during COVID-19 pandemic. It came at a time when countries were not prepared, and we have seen the economic ramifications that happened because of that pandemic that occurred, which is what we're still trying to recover from. Now, this particular initiative is being implemented through the health sector strategic blueprint. The blueprint is guided by 4 pillars enumerated above, 3 enablers, and these are data and digitalization, financing, culture, and talent within MDAs. The pillars and enablers are further broken down into 18 strategic objectives, 27 priority initiatives, 265 interventions. In Nigeria, the framework was designed to tackle critical issues plaguing the healthcare system, including inadequate infrastructure, shortage of healthcare professionals, poor financing, with a goal to improve health outcomes in Nigeria. What are the priority areas in Kebbi State? We need to improve reproductive, maternal, newborn, child health, and nutrition. If you look at our statistics, you will see that there is a clear need for us to address this. We need to accelerate immunization programs for priority antigens. We need to slow down the growth of non-communicable disease prevalence. This is what we are seeing. Individuals are moving, they are apparently healthy. The next thing is that there is just syncopal attack. Somebody will faint, will collapse, and the next thing that individual is dead. So we need to be able to have a strategy so that these non-communicable diseases are really reduced in their prevalence. Reduce the incidences of HIV, tuberculosis, and malaria, particularly because there is a dwindling intervention or support by the donor agencies. We are aware of the mistakes and the intervention they are doing, and part of the funding that is not readily available. There has to be mobilization of local resources so that these interventions can continue. There should be improved quality of care and service delivery in primary health care centers. We should expand financial protection for all citizens through health insurance expansion and other innovative financing mechanisms. At this point, I want to mention what is happening in Nigeria is that apart from the implementation of the National Health Insurance Agency Act, it has made health insurance mandatory. Individuals are supposed to register themselves and their families. If you are able to do the registration, you are now giving financial protection to your family. If your family cannot do, as philanthropists, as leaders, as elders, we can decide to ensure communities so that when you ensure with 15,000 naira under Kechema, one particular head is actually captured. And there are programs that are happening. 2 of them I have to mention. One is the CMONK initiative of the federal government. It's being implemented in all the states across the country. If you go to General Hospital Zuru, General Hospital Yauri, General Hospital Argungu, General Hospital Kamba, Sayaha Memorial Hospital in Birnin Kebbi, and Federal Teaching Hospital in Birnin Kebbi. As a woman, if you do not have money, you can be delivered safely. All emergencies around obstetrics are fully and 100% covered, and the statistics is there. Many people are not aware, but it's happening. We are reversing the number of people that have to pay so that they can access maternal care. In Federal Teaching Hospital Birnin Kebbi today, as a newborn baby, the first 48 hours is free. And this is also going to be extended to all children under 5 years. But this is only happening within the Federal Teaching Hospital. It should equally happen in all the other general hospitals in the state. We need to increase availability of human resources for health. One major area that we have in Kebbi as a challenge is the inadequate number of doctors to look after us. This is not peculiar to Kebbi, it's for the whole country. But one thing that is peculiar, we have depended largely on people from the other parts of Nigeria to come and work for us. We need to produce local indigenous doctors. I'm happy to announce Federal Medical Center became a teaching hospital last year. And today, we already have 400 level clinical students. In 2 years, we will start producing doctors in Kebbi. So if we have this effort complemented by what is happening again in ALIYU University, if that is going to be sustained, it means we will begin to be able to produce our doctors that we need to retain in-house and even export for other activities. We need to stimulate local production of health products such as vaccines, malaria net, and food. We need to improve pandemic prevention, detection, preparedness, and response. We need to strengthen health data collection, reporting, and usage, starting with the core indicators. We need to improve regulation and regulatory process. I'm on the last page, our key policy recommendations. What are the key policy recommendations? And this is equally important speaking to Kebbi State. There has to be improved allocation to healthcare. If I look at the 2024 State of the Health Report, that is a document that has been launched at the national level. It has reported every state of Nigeria. One key finding in that particular report is that if you look at the proportion of the health budget to insurance in Kebbi State, that is great. So it means there has been an investment in financial protection. Kechema is doing a wonderful program, but the state government need to improve in that particular regard. So we need to allocate our resources beyond 6-7% of the annual budget to at least 10%. Going forward, 15% is the target. We need to explore opportunities to be able to produce vaccines, medicines, medical consumables. There is one area with what is happening in the insurance industry. You will see even some of the suppliers of kits, consumables, drugs. You see the market is public. Because if the government says they are going to ensure health insurance for Nigeria, it means you have to get all the commodities and the government will pay you later. So we need to look at those areas, not only in supplies but in production. We need to have a one health approach. Primary, local government, secondary, general hospitals, tertiary, that is the federal medical centers and teaching hospitals. There should be sustained human resource for health development, and there should equally be strengthened national health management information system. We must invest in ensuring that there's energy security, even if it is through solar system for all our health facilities. We must ensure that gradually we are adapting technology. If you go to Federal Teaching Hospital Birnin Kebbi, 80% of all our processes are now done through an automated system. It's actually through automation. So we need to adapt that so that you do not have an opportunity to influence any data. Whatever you have is what you have. I want to sincerely thank this distinguished forum for giving me the privilege to share a little knowledge on this particular topic. Thank you and God bless you.